The committee will come to order. Before we begin, I know that most of us have felt the impact of rising healthcare costs and that many of us have strong feelings about healthcare affordability. I also know that not everyone in this room will agree on every issue, but I want to remind our guests in the audience that the chair is obligated under the rules of the House and the rules of the committee to maintain order and preserve decorum in the committee room. Disruption of congressional business is a violation of the law and is a criminal offense. Violations will not be tolerated, and violators refusing to stop will be removed by law enforcement and subject to arrest. I ask that we all abide by the rules and be respectful to our viewers and those in the room, including members of the audience and witnesses. I appreciate your cooperation in making sure that we have a civil discussion with our witnesses today. I'd like to begin first by thanking our witnesses for voluntarily agreeing to appear before the best committee in Congress today. You were in another B committee earlier, but this is the real committee. We are gathered here for one simple reason. Healthcare is increasingly unaffordable for American families, workers, and seniors. Today, the average family insurance plan costs roughly $27,000. Deductibles exceed $3,000 for individuals and as high as $10,000 for families. Obamacare premiums have climbed 80% in the last 10 years, and families on exchange plans are exposed to out-of-pocket maximums of over $20,000, while 1 in 5 medical claims are denied. But it's not only in the exchanges, which reflect just 7% of the population. The private employer marketplace that you all participate in, and the more than 160 million Americans for whom you provide coverage, is also experiencing the largest premium increase in 15 years. Health spending in America totaled $1.4 trillion in 2000. Today, it has tripled to $5.3 trillion. Nearly 1 out of every $5 in our economy is tied to healthcare spending. In short, Americans are paying more for coverage than ever before while getting less peace of mind and less access to care in return. Ideally, insurers would help control cost and guide patients through our complex healthcare landscape. But today, patients are forced to navigate systems designed around insurer priorities, not patient needs. After paying thousands of dollars in premiums each year, families are forced to ask insurers for permission to access their own health care, only to face crushing out-of-pocket cost. There is not one single American that I have met that believes health insurers are effective at lowering cost. This hearing is the first of more to come, examining the entire healthcare sector. Today, we will ask some of the largest health insurers why costs keep going up and how health insurers should make healthcare more affordable for all Americans, a question that my Democrat colleagues all but ignored when they were in the majority. And here are the results. Americans are still struggling to afford just basic care. Health insurance premiums are exploding, and patients are delayed and denied care every day. But instead of demanding answers, a senior Democrat reassured our CEO witnesses this morning, saying, quote, "It's not your fault." Maybe because Democrats knows it's their fault. Because after 15 years of a Democrat-created health system under Obamacare, prices have only gone up, not down. They have only gone up. I'd also like to remind my Democrat colleagues that these same corporations have exploited market power and vulnerabilities in federal programs to consolidate control, steer patient care, and maximize revenue. 3 of the largest health insurance empires rake in nearly $1 trillion in annual revenue, pocketing tens of billions of dollars in profit. For this, their executives are rewarded with tens of millions of dollars in bonuses. This is all made possible by the taxpayer. 90% of insurers' Obamacare revenue is taxpayer funded. The tax break for employer-sponsored coverage is worth $4 trillion for health insurers. And Medicare Advantage insurers will receive more than $8 trillion over the next decade. Yet patients, families, and seniors still struggle. They struggle to afford care. Health insurers claim consolidation yields efficiencies and is necessary to survive regulation. It's not survival when 3 health insurers control nearly half of the market and 3 PBMs control over 80% of drug benefits. Meanwhile, if efficiencies are meant to lower cost, why are insurers raising premiums, limiting competition, and shifting more cost onto families and taxpayers? To be fair, blame can also be directed at federal mandates, draconian pricing rules, and open-ended subsidies intended to expand coverage and make it more affordable. Over time, these policies, in many cases, have had the complete opposite effect. They have rewarded higher spending, complexity, and consolidation. Government health insurance subsidies have drawn bad actors to fraud like moths to a flame. Large federal programs require clear guardrails and accountability. Sadly, you won't hear my Democrat colleagues grapple with the existence of fraud and abuse in our health system. They just want to cover it up with more taxpayer dollars. And that's a shame, because acknowledging these problems is a necessary step toward reform. Republicans are clear-eyed on reforming our healthcare system for the better. Last week, President Trump released the Great Healthcare Plan. His bold frame worked to lower costs for families and hold abusive middlemen accountable. We must restore affordability, strengthen competition, and ensure that federal health policy works for all patients and all taxpayers. I look forward to hearing from our witnesses about what concrete steps they will take to address these challenges and how they are prepared to work with the committee in the future to lower health care costs for all Americans. I'm pleased to recognize the ranking member, Mr. Nill, for his opening statement.
Thank you, Chairman. As you might conclude, we have a different perspective on the issue that's in front of us. I want to thank you for the hearing. But a theme of this Congress has been Republican silence, as our colleagues on the other side rubber stamp everything that the President says and does. We're here for one reason, for sure, and the reason that we're here is because they've refused to extend these tax credits. When we hear that costs have gone up in the last 3 months, it's because the credits have not been extended. That's the reason. On this dais, we've been warned that the danger of DOGE meddling with the American people's most private data, and the other side acted as though we were hysterical. What do you have to say now that the Trump administration, who has admitted through court filings that Social Security data was illegally shared for the purpose of election interference? Then there's the silence on the affordability crisis created by the President. House Republicans have hamstrung their own ability to act, leaving the illegal tariffs in place. That's led to price hikes as well that imperil our global relationships. Trillions of dollars in retirement savings were wiped out 24 hours ago, and now they've been returned. That's the happen.
Congress just dragged the CEO of UnitedHealth in front of lawmakers. And what happened next is something every American needs to see. Watch the full hearing below, drop your thoughts in the comments, and subscribe so you never miss what they don't want you to see.
Over the last 12 years.
Okay, but Mr. Cordani, respectfully, you were compensated $23.3 million last year. And what I'm seeing is perhaps the beginning of an industry-wide trend or commitment to try to ensure that patients don't go without health care. Is your answer still no?
Congresswoman, we made a pledge recently to reinvent the PBM offering for the marketplace, and it's going to reduce our earnings by $500 to $600 million next year. We've made that commitment. That comes out of every executive's opportunity next year. That will affect all the lives we serve, including those on the exchange, and we estimate that it will improve costs for every individual out of pocket. So we were seeking a much more scaled solution than for just the 1%.
I believe the answer is just still no. Ms. Bordeaux, will Elevance reinvest its 2025 profits to stave off the premium increases due to the failure to extend the ACA tax credits?
Congressman, we are willing to look at any proposal, but I just want to be clear on expectations because, as we've been discussing, this won't address the root causes of what drives premium up, which is the cost for services and the continuity of care. We did not make any money on the individual exchanges in 25, and we don't know how 26 will play out. So again, we want to be part of the solution, but want a meaningful long-term solution as well.
Yes, but Ms. Bordeaux, isn't it true that Elevance reported a $50 billion operating revenue this past year, primarily due to Medicare Advantage? I get the exchanges maybe not so profitable, but Medicare Advantage seems to be doing pretty well for your company, and your salary you personally made about $20.5 million, and none of that can be reinvested to help patients keep their health care?
Congresswoman, again, we are very interested in being part of the solution. Medicare Advantage, we also made a very minimal profit, not to the revenue you cite, and it's a highly regulated environment, very competitive. We seek, again, premiums a result of the costs that we pay underlying to support services and the members in those programs. We're looking at
so then I take it
sustainable solutions, and again, want to be part of that solution.
Okay, I take it the answer is no. I want to pick up where my colleague Lloyd Doggett discussed denials. It's outrageous to me that over 80% of prior authorization denials are overturned. I think that plans should be penalized for these inappropriate denials. I just want to give like a very quick personal experience of that. I had knee replacement surgery earlier in the year last year. Was supposed to start in-home physical therapy immediately. Had my own challenge being in pain and on pain medication with my insurance that denied me the in-home physical therapy, although my orthopedist and every nurse said that it was critical to begin the physical therapy right away. And I'm a member of Congress and was on the phone battling with my own insurance company, which, by the way, members of Congress, to dispel any belief out there that we have the best health care in the world, I buy my health care off the DC exchange. I think that the prior authorization denials and then the fact that they get overturned on appeal so frequently means that these denials are purposely denying claims so that they're forcing people to prolong their care, which leads to worse outcomes. And I think that that is something that we really need to address. All of you need to really help address that. And with that, I will yield back to the chairman.
Thank you, Mr. Arrington.
Thank you, Mr. Chairman. Panelists, very concerned about the rising cost of health care, like everyone in this country. As the budget chairman, I have the honor of representing my colleagues in that role, and there's no way we're going to reverse the curse and change our fiscal trajectory that is completely unsustainable if we do not address and bend the curve on the cost of health care. It's crushing our families. It's a drag on the economy, and again, it's a threat to my children's future, and we've got to do something about it. A third of the federal government's budget is health care. 50% of all health care dollars are controlled by Washington, D.C. In the 80s, it was only 30%. Obviously, medical inflation is outpacing all other goods and services exponentially. and it's unsustainable. One benchmark for the American people to get a sense of this explosion in cost. We spent $19 billion in 1975, around 5% of the federal budget. Today, we're spending almost $2 trillion on health care, and it's a whopping 1/3 of the budget, as I mentioned. We've got to do something about it. We have to get the incentives right. We need the partnership with the private sector. I agree with my colleagues, competition, choice, transparency. I mean, no central planning here or anywhere is going to deliver the kind of value that you can deliver if we put the incentive structures in place and guardrails so that everybody wins. But I don't believe that that balance has been struck. I want your expertise, your insurance market expertise on Obamacare, because I do think that one of the problems with these perverse incentives have been directly flow from the creation of these tax subsidy, regulate, mandate programs. This was pitched, sold as the Affordable Care Act. Premiums and deductibles have doubled since the inception of Obamacare. Shake your head up and down if you agree with that. Raise your hand if you agree that they have doubled premiums and deductibles since Obamacare, the inception of Obamacare. Okay, everybody, okay, because it's just math and it's just data. And when you add the subsidy to this from COVID, which doubled the cost to the taxpayer, by the way, didn't double the number of people that were getting this insurance. In fact, if you deduct the 6.5 million people that are ineligibly on the program, maybe it's a third. Do you know how much, on average, the premiums have gone up on the exchange since my Democrat colleagues doubled down on the, quote, Affordable Care Act? Twice. So, Mr. Hemsley, is Obamacare, are the cost within Obamacare more or less than the inception, than when Obamacare was first passed? More or less?
Representative, the cost of all health care has increased.
But has Obamacare's premiums gone up twice as much as those in the private market and with employer-sponsored insurance? Have they outpaced the private sector and employer-sponsored insurance plans?
I can't say that they've
Well,
outpaced.
does anybody know the answer to that question? You don't know the answer to that?
Well, Congressman, in California, they haven't been dramatically different, but I can't speak to it nationally.
Well, we have according to CBO, 6.5 million ineligible people that are being subsidized by the taxpayer, that are not legally eligible. By the way, there's also billions of dollars in fraud. There are dead people's Social Security numbers used to send the subsidy to your insurance company. And everybody else up here. My question is, do you know that fact? And if you do, what are you doing to stop it so we can steward tax dollars, so we can make sure that the subsidy, as much as I think the underlying policy is flawed, is at least going to the people that it was intended to? What are you and your company, what are y'all doing to increase program integrity, prevent fraud, waste, and abuse of tax dollars?
Well, fraud
6.5 million ineligible people.
Fraud is unacceptable everywhere. I'm proud of the work we've done in California, where we've implemented things like dual-factor authentication to verify eligibility. So we have not seen that kind of fraud issue at that level in California. And I'm happy to talk also offline about the things that we've done, I think, that have led to that result. Again, I can't speak beyond our market, but that's our experience.
And I'm not
in the
picking
market.
on you, quite frankly. It's across the board. Somebody's not putting the controls in place and paying attention. And we've got to change that incentive structure for the sake of the taxpayer and our future taxpayers who would be our children. So with that, I've gone over my time, Mr. Chairman. Thank you. I yield back.
Thank you, Mr. Arrington. I want to inform members that the votes have been called on the House floor, and I intend to call a recess following the end of my questioning period. Committee will be called back in order immediately following the vote series. I recognize myself now for 5 minutes. I had brain surgery myself 5 weeks ago, and I don't care if I was on dialysis, if I had an LVAD in, or if I was intubated, I was going to be here. I have been a physician for 35 years, and sadly have had a front seat to witness the decay and decline of one of America's largest industries, and that's the health insurance industry. I have had patients cry in my room. I have had physicians cry to me, throw up their hands in disgust, and quit because of actions of our health insurance industry. Nothing you're going to say to me today is going to change that. You have put profits above patients, and you've put profits above